said that this helped her greatly in deciding that she need outside support and showed how to obtain it. And
a bridge with our living lab, because the living lab is a key element where all the souls of the reference site come together in driving innovation and implementing innovation through adaptations.
we should not fall into the myth that aging can be well engineered.
To always work at local, national and international level. Don't lose your anchors. You need connections all the time at all three levels.
Ecosystems in Health and Care, the THCS podcast.
Episode 3 of Ecosystems in Health and Care, the THCS podcast, highlights ecosystems that are reshaping the way Europe thinks about aging. Instead of framing old age as decline, these initiatives show how communities, digital tools, and social innovation create autonomy, dignity, and connection. Maddalena Ilario with the University Hospital Federico II in Napoli showcases the Campania Reference Site in Italy, integrating research and care delivery. And Katrin Paldan with the Vorarlberg University of Applied Sciences introduces us to TeleCareHub in Austria, using digital platforms to support dementia care. Together, they illustrate that aging well is less about avoiding decline and more about building meaningful connections supported by ecosystems. I'm your host Ursula Hessin with Red Swan Vienna Austria, and it's my pleasure to interview the lovely guests of the THCS podcast. Let's just do it. We actually really dive into the warm-up questions. So Maddalena, when you hear the phrase aging well, what does it mean in your context? What does it mean to you?
I think that the concept of aging has a very strong sociocultural background. So a lot depends on the values that are locally rooted. So in our context, the social connections are very important. And aging to most older adults means aging independently and in a community where valuable activities for them are available. So in our context, people, older adults like volunteering in general, people like volunteering, exercising, doing cultural initiatives together. So when these activities are intergenerational, they become even more successful and they become also more sustainable, because you can involve schools, churches, universities, clubs. And in our experience, this has proven in line with what is the idea of aging well for our older adults.
So it's a lot about connection.
Yes.
And Katrin, as I understand it, the TeleCareHub is a digital tool, right? Can you recall a moment when a digital tool or digital tools actually made a real difference in someone's life in aging?
Yeah, maybe there's one example from our currently conducted pilot study with digital services for informal caregivers. The services include a stress check and an information on how to find support. And one participant said that this helped her greatly in deciding that she need outside support and showed how to obtain it. And she said this was an important milestone for her, as that this objective view on her situation, completing with her subject view, helped her to make a good decision for her.
That sounds fantastic. But it's of course not only digital tools. Digital tools can help you to connect. So Maddalena, what role do communities play in supporting people as they age?
The communities are the place where people see their role, their identity recognized. When you retire, you lose part of your working identity, and it is a place where you can find a sense of purpose and belonging in the community. So if you have a community that engages you in meaningful activities where you can feel useful, I think that the community is fulfilling the role and valuing what is the experience of the older adults, bridging it with the young people, because sometimes sense of isolation and the need to be seen by someone else strengthens also young people. It needs also younger adults and adolescents, and this is an experience we made in a project to strengthen adherence to healthy lifestyles with schools, and we brought together older adults and younger kids for to motivate them the use of digital tools and in the support to healthy lifestyles, changing lifestyles.
So it's also working together across generations.
Yes, they can teach each other things, you know.
Yes, and isn't it actually a very natural way to live together?
Yes.
Families, I'm from the Austrian countryside. Big families were the habit there. I grew up in a, well, we are four children, but I always visited another family. They had like 11 children, and I just love to be there. So the whole village, the whole community actually cares for a kid, and all the generations are together. So actually, you are kind of going back to that, right?
Yeah, yes and no, because
Hmm.
in southern Italy there is still a big rate unemployment for highly skilled graduates, so they tend to go abroad, and this is an issue. So the availability of the evolution of the work environment through using online connections and strengthening digital skills is very important, because it might create new working environment and job opportunities, and reduce the need to go abroad. So this would strengthen local communities, ensuring that this concept of shared responsibility and burden
Hmm.
for weaker people is ensured also in the future.
I think this is a very interesting point and very important shared responsibility and shared burden. I think TeleCareHub is a great example for a very difficult topic. You are focused on dementia support. That's probably one of the hardest challenges also for the family, right? So, how does your platform combine digital tools with real human warm care? Katrin.
Yeah, our digital tools is especially for family caregivers of people with dementia living at home. And the services we provide include, for example, knowledge and information resources, a stress check for caregivers, but also video consultations with experts and moderated self help groups, for example. So, for these personal assisted services, we work closely with the local care and social providers, like for example, home nursing care services or mobile assistant services in our region. So, yeah, to sum it up, when caring for people with dementia, it is important to be able to make informed decisions for others and for yourself. And this requires information, but also tailored advice and a very well support from, yeah, the social environment.
Madalena, let us talk a little bit more in depth. What is the Campania Reference Site? Explain.
Our reference site is a flexible organization. It is grounded on in our university, but the flexibility of the organizational structure is what allowed us to survive many years. Because when you have a well structured organization, and over time there are changes in the management that can hinder the capacity of the reference site to flexibly keep developing and deploying the good practices you work on through the European project. So, being flexible and being grounded in the university has ensured the time to consolidate the content of the reference site. And this, I think, is a very good lesson to learn. The stronger the structure, the higher the risk that someone doesn't like it, and because it doesn't meet the priorities or whichever ideas of the top management in the hospital or in the university or in any other organization of the quadruple helix that characterize the reference site, and you are relented, slow down in your exchange of knowledge. The university also provided an environment for interdisciplinarity, because it's easy to access multiple disciplines, and this ensures a cross fertilization of content that is very precious for innovation and for implementation of innovations. So the ecosystem that Campania Reference Site has been working on is very rich in architects, in engineers, clinicians, social workers, local organizations, no-profit organization, connection with schools, municipalities, and we are trying to create a bridge with our living lab, because the living lab is a key element where all the souls of the reference site come together in driving innovation and implementing innovation through adaptations.
That sounds really very interesting. So actually you
Yes.
managed to bring all these different stakeholders together. Did I hear that right? You have architects, engineers, social workers, university all together. For how long are you actually doing that?
Since 2013, it has been an iterative process.
12 years,
Yeah, 12 years. Yeah, it took a long time, but
but it
yeah,
works.
it works. I mean, it depends on what do you, the measure of success for you. What's the measure of success for you? For me, it's the difference we can make in other people's life. You know, if you can make a
Yes.
difference, then it means you are successful.
And I also would like to stress the point you made earlier: generations working together, solidarity across generations and working together. And I think that's something that you also did very well at the Campania Reference Site, right?
Yes, that's the effort we constantly carry out because we have been witnessing then that social isolation, sense of belonging needs to need to be addressed also in younger generations, and this is something that we can do together. So this is something that we can reciprocally teach it to each other across the generations and improve quality of life during the life course. It's not just an issue of the aging population.
Absolutely. It's not an issue just of the aging population, as you just said. Katrin, you just mentioned the social environment. What role do families and informal caregivers play in making this ecosystem actually work?
An essential role. The Austria Dementia Report shows that about 4 out of 5 people with dementia are cared for at home, mostly by relative caregivers and often family members. In other words, in Austria, around 80% of all people in need of care are supported by informal caregivers.
80%. Well, that's a
Yes,
lot.
and yes, really. And yeah, these families and the informal carers are really the backbone, let's say, of dementia care, and they have to be well connected to the service providers in their regions.
Mm.
And yeah, that's where the initiative like TeleCareHubs, but also others come in. And we want really to support, especially these very big and very important group in their valuable work they do.
Sometimes people say that like digital tools just lack the human warmth. What would you respond to that? Maybe it's actually the opposite. Maybe these digital tools can actually contribute to connect human warmth. What is your perspective on that?
Yeah, of course, a little bit depends on how familiar the people are with digital tools before. When you're in such a situation and you care for others, and maybe you're a little bit stressed and it's challenging, you don't go to another kind of conversation. Maybe you don't accept it. But for people who are familiar with it, it could make a benefit to reduce time you have to drive or you have to wait for an appointment. It can save time and ways you have to do for a personal meeting. Informal carers could benefit from digital tools since the information is quality assured. There are trainings where you can also yeah, you reflect your situation, but also read how others deal with it. And the peer exchange is also easy when you have a kind of an online meet up. That's for some people maybe helpful to not have to go to another place and be present, but use this easy accessible, yeah,
Mm.
online
Also for peer
conversation.
exchange, that's also a very good point you made. Other people who suffer from the same thing or who have the same burden, right? They can support you, they can morally just help you to deal with it in a better way. As we mentioned before, old age isn't the problem, it's actually disconnection, and not only between old people, right? Between all the generations, between all the caregivers, between everyone in this ecosystem. Madalena, how do you integrate research, innovation, and the daily care for older citizens? I think that might be difficult, isn't it?
You know, this is actually there is a trick because when you are working in a university hospital, your institutional role is to integrate research, training, education, and service provision. So we are built with this mission. Plus, when you put the third mission of the university, that is engaging citizens, that completes the picture with the living lab. So it's very important. We are now working on a national ecosystem where we are trying to adapt the concept of living lab into something that is inspired to annual structure, but is more flexible and has a low minimum content that can be replicated in an hub and spoke concept in also settings that have a very low technical infrastructure.
Sounds like a really big challenge. As far as I understand it, it took 12 years to get this going. I think that's also a very important point. These are always long term goals, right? And we have to build ecosystems. You build it over 12 years and now you see the
Yes.
fruits. So we cannot expect that something will happen within a year, right? You cannot just start a project and that's it. And this will do anything to actually transform the health and care and how we age and how we care for aging people, etc.
Yeah, it's a continuous improvement. Is an approach that is iterative, so it continuously improve. What the ecosystem does for the projects is it ensures that the product is not dispersed. It doesn't fade over time. You have a place when you can nurture the results, you can foster the implementation, the adaptation, and transfer until the next project arrives. So you need a place to stay and hang on when the funding
And
is, yeah, when funding.
yes, you need to hang on, you have to have a common vision, you have to be committed, and it has to go for many, many years, right?
Yeah, you need the anchor.
I would like to ask the closing reflection questions. What is one lesson from your experience you want every ecosystem to remember? What can you teach them from your experience?
Actually is to always work at local, national, and international level. Don't lose your anchors. You need connections all the time at all three levels. This is was the best suggestions I was given by policy officer of DigiSante in 1213. I still remember, and it was really important because when you slow down on one of the levels, there is always a hook somewhere else to help you and go overcome the bottlenecks, the issues, and don't give up because
Don't give
if you
up, yes.
don't give up, it takes time. You need just to have a short, medium, and long term goals. You will always find someone else along the journey. So it's a journey.
One lesson you want every ecosystem to remember from your experience.
It's important that a long-term strategy is needed to build a digital ecosystem. Regional players and provider must be involved and made part of the ecosystem. This increases trustworthiness and acceptance among provider and the user groups.
Yeah, absolutely. And for how long are you working on the Telecare Hub now? When did you start?
We start in 2022, so almost 3.5 years, and the project goes for 4 years, and we hope that we will find an ongoing financiation because the ecosystem is growing and maybe it still needs more to grow, but it's on a good way, and it will be great if we can continue with this work.
Yeah, and as Madalena already showed us, you need a long time. They started in 2012,
Oh, yeah.
like 10 years earlier than you did, right? So we need
Yeah.
some time to actually evolve into really working ecosystems here. And what is one myth about aging you wish to bust?
I don't think so. I mean, aging is your age when you stop doing things. So I never stopped. I think that as long as we do not force a nature and quality of life is okay, we can live as long as we can. I don't know. I think it's a matter all about the quality of life.
It is quality of life. That's correct. And communities, ecosystems can support that a lot and contribute a lot to that. Like old age is not really the problem. Disconnection is, isolation is,
Yes,
loneliness is.
absolutely.
This I think that might also make you age quicker,
Yeah,
right?
and yes, and I think the concept of connection of connected ecosystems is important also to strengthen cohesion between the sociocultural areas in Europe. It's all about connections also between sociocultural elements, and the idea of connected ecosystem is very important for Europe because it is how we are conceived and there is a lot we can give to each other, reciprocally exchanging sociocultural content. The digital tools just accelerate, support, foster, and strengthen this exchange.
Is there any myth about aging you would like to bust?
Yeah, for my field of research, the digital health field, we should not fall into the myth that aging can be well engineered by pulling through
That's
technical
a very good
innovation.
point. Oh, yeah, I love that point you just made. People treating the whole human body like a machine and just say you can well engineer it. That's a perfect point. Can you unpack that a little for us?
Of course, yeah, digital tools, telecare, maybe smart homes can support health-related outcomes, can support safety, autonomy, but aging is not just about gadgets or apps, of course. It's about relationships, belonging, purpose,
Preach.
and communities. You mentioned this earlier, and yeah, making aging well likely means developing and refining socio-technical ecosystems and empower people to interact with their socio-physical environments and use a well-designed tech, but for social connections and for quality assured information.
So, is there any wish for the future of health and well being at any age you would like to leave us with today?
Yeah, never alone. That's the
Never alone. That's very
never
beautiful.
alone.
Yes, never alone. That's powerful. That's beautiful. Thank you so much, Madalena. Katrin, is there any wish for the future of health and well being at any age you would have and like to leave us with today?
Yeah, thank you for this question. Yeah, maintaining or restoring peace, first of all,
Mhm.
cohesion with the European community, and yeah, strategically wise investments in our society and healthcare system so that many, better all, people can lead fulfilling lives for a very long time.
That's the perfect final word. I can add nothing to that. Thank you very much.
Thank you.
Thank you.
You've been listening to episode 3 of 6 of the THCS podcast, Ecosystems in Health and Care, a podcast about the future of health and care in Europe, told through the voices of the people making it happen. Each episode brings together real-world ecosystems and visionary experts who are breaking silos, building trust, and transforming systems. One aligned action at a time. THCS stands for Transforming Health and Care Systems and is a 7-year initiative funded by the European Commission. This podcast is produced by THCS Work Package 9, which focuses on strengthening ecosystems, the key to tackling the complex challenges of today's health and care systems. Because collaboration is not the end of innovation, it's where real change begins. If you liked this, we have more for you. There are 5 more episodes on Spotify, Apple Podcasts, YouTube, or wherever you get your podcasts from. See you in the next one. Ecosystems in Health and Care, the THCS podcast.